It's a disease condition in men. Quite common, up to 20% of all men will develop this condition at some point in their life. And it's a condition that could make you infertile. In other words, you may not be able to father a child. There's so little knowledge about this condition. In this video, I'm going to open things up a bit so that you can understand this thing and begin to check for yourself. And most importantly, for your sons as well. Because if we don't detect this disease condition early, it could result in atrophy of your testicles. And so it is important. So stick and stay. I'm Dr. Kelvin, your wellness consultant, and you are welcome to my channel. My goal is to educate you when it comes to your health so that you can make the right choices and prolong your life as much as possible and enjoy all that God has put on this earth for you. So welcome. So let's talk about varicocele. Yes, varicocele. Have you heard about it? Have you been diagnosed before? Well, you're not alone. 20% of men, that's 1 out of every 5 men, will develop a varicocele at some point in their life. Now, what's a varicocele? Basically, it's a varicose vein inside your scrotum. Now, I'm sure you've seen varicose veins on the legs of athletes, especially bodybuilders, weightlifters, people who are obese. They tend to have varicose veins, which are engorged veins all around the lower limbs or any part of the body for that matter. When it happens in the scrotum, it's called a varicocele. Why is it a big deal? Well, you understand already, if you have been subscribed to my channel, that the testicles hang outside the body for a good reason. The optimum temperature needed for producing quality sperm is about 1 degree to 5 degrees less than your body temperature. And so your testicles are hanging out there so that the temperature in the scrotum will be lower than your body temperature. When you develop a varicocele, which means that the veins in the scrotum become engorged, blood pools in the scrotum. And this blood staying there increases the temperature. And so this is the first reason why varicoceles tend to affect fertility. Note, most men who have varicoceles will not have a challenge with fertility, but some men with varicoceles will have fertility challenges. In fact, if you are already struggling to achieve pregnancy and we notice that you also had a varicocele, then it could be that the varicocele is responsible for your infertility. And so we will have to deal with that. So what causes the varicocele? We actually don't know the exact cause of varicocele. It could be that the valves in the vein that are supposed to prevent the backflow of blood are damaged. And so for that reason, the veins are not able to carry blood out of the scrotum. And this is why they become engorged and then cause those issues. Who is at risk of varicocele? All men are at risk of varicoceles, regardless of your age or even the kind of work you do. All men are at risk at all ages. We've seen varicoceles in babies, in children, in teens, all the way up to young adults and even the elderly. And so it's important that all men take note of these things and examine their scrotums as often as possible to make sure that there's nothing there, especially in your young children who may not know what is going on. How would I know that I have a varicocele? The classic presentation of a varicocele is the scrotum feels like a bag full of worms. That's the classic presentation. But quite apart from that, other symptoms that you might experience would be a dull ache in the scrotum. Varicoceles are more common on the left as compared to the right. This is because of an anatomical difference between the left side and the right side. And so you typically find these symptoms on the left. You might experience a shrinking of your testes on the affected side. And so if you are observant and you notice that your testes on that side is much smaller than on the other side, do get examined because it could be a varicocele you are dealing with. You might also find that the testis has some nodules all around it. So these are things that should draw your attention and cause you to want to go get a checkup so that if indeed it's a varicocele, we can deal with it as soon as possible. The treatment options are numerous, but with surgery being the eventual goal. If you have a varicocele which is especially causing you to have fertility issues, surgery would definitely be recommended, and I urge you to take up that surgical approach so that you can deal with the varicocele once and for all. So with the shrinking of the testes, you could suffer a decline in your testosterone level, and so it's not something to be toyed with. So if you do have a varicocele or you're diagnosed with a varicocele, please follow your doctor's instruction and deal with it as soon as possible. Have a fabulous time. Remember to subscribe to the channel, leave a comment, leave your questions, and I'll address them as soon as possible.